It may have no symptoms, but left untreated, an aneurysm is a ticking time bomb. Surgery used to mean a long hospital stay and recuperation time. But at Community Regional Medical Center, advances in surgical techniques are cutting recovery time, making surgery a life-saving option for more patients. Jim Dennis is an active 72-year-old. Retired from teaching and the military, he stays busy with family and his garden.
I'm pretty active. I don't sit and watch TV a whole lot.
Dennis has a history of heart problems, and when he began to experience some uncomfortable symptoms, he didn't waste any time getting to the doctor.
I just had a hard time breathing and had mild chest pains.
Tests revealed an aneurysm in Dennis's aorta. That's the main blood vessel that runs from the heart and supplies blood to the rest of the body.
An aortic aneurysm is where the aorta, the biggest artery in the body, swells over time, and like a water balloon, as it stretches more and more, the wall gets thinner and eventually it's prone to rupture. When the aorta ruptures, more than 50% of the people die before they can even get to the operating room.
While Dennis had specific concerns about his heart because of his history, Dr. Stern says many aneurysms are discovered almost by accident.
These days, when patients go to the physician complaining of a variety of things, abdominal pain, back pain, there are lots of things that generate some kind of imaging of the patient's abdomen. Well, when you're imaging for something else, you often see the aorta, so you sort of tumble to this diagnosis when you wouldn't have made it otherwise.
That it was discovered down low, right above the Y where the arteries split to go to your legs.
A rupture can be fatal. The location and size of Dennis's aneurysm made him a candidate for an endographic stent graft. That's when doctors insert a reinforcing tube into the aorta.
Now, when you talk about the endovascular stent graft, it's two small incisions, about a 2.5 to 3 inch incision in each groin, 2 incisions, instead of a big major abdominal incision. And we put the device in through the artery with a catheter. The device is inside the catheter, and it's deployed by pulling the outer sheath of the catheter back, and the device sort of pops open inside the aorta.
Dr. Stern performed Dennis's surgery at Community Regional Medical Center.
I got there real early one morning. They did the operation in the hospital overnight, and was released the next day to come home.
With this procedure, most patients can have their aortic aneurysm repaired with a 1 or 2 day hospital stay, and all they ever miss is breakfast.
The operation takes about 2 to 4 hours, but Dr. Stern says the advantages of the endographic stent graft procedure over an incision are clear.
So instead of losing 10 pounds, having no energy for a month, really not being able to return to normal activities for as much as 2 months for the people in the older age group, our patients are returning home the next day, not missing a meal, not losing any weight, and frequently back to their routine activities within a week.
I was bruised basically from my knee to my navel, but other than that, it didn't limit me as far as recovery type thing. It was very normal. I just took it real easy for a couple of days, maybe 3 or 4, and then I could do mild stuff, taking it relatively easy.
Dr. Stern says small incisions and shortened recovery time means patients who wouldn't normally be candidates for such a big operation due to age or health problems can benefit from the surgery, but not everyone is a candidate.
The aneurysm may be too long or too big, and we have insufficient normal artery to seat the graft properly.
These are the internal aortic arteries.
When endographic stent surgery is an option, Dr. Stern says radiologists are an integral part of the team.
So you have two different perspectives coming to the table. The radiologist who has historically done everything that required imaging, and the surgeon who is now doing things that require imaging but also has the background of doing open procedures.
He expects the future will bring even more advances in medical procedures. For now, patients like Jim Dennis are enjoying a quality of life made possible by the life-saving surgery.
I do just about anything I need to do, only I just take it a little easier than I did 20 years ago.
Community Regional Medical Center is currently the only hospital in Central California offering endoscopic surgery to repair aneurysms. For more information, log on to our website. It's medwatch.communitymedical.org.